I also see it as a life jacket in these choppy waters of COVID-19.
It's called Nurture Science, and for Holly Wayment, a mom of three, it's been life-changing for not only her kids, but for her as a parent as well.
To take that time to be at eye level with eye contact is magical. And if we aren't intentional about it, it can easily be lost.
Nurture Science focuses on connection, and at a time when so many of our connections have been cut off by COVID, it's even more critical to find that where we can.
We are seeing mental health changes all across the community, all across ages. And then, for me being a pediatrician, we are seeing that those increased rates of depression and anxiety and just not being in those social situations that are normal to them.
The Nurture Science program at Columbia University focuses on research looking at babies in the neonatal intensive care unit who were born sick or premature and lacked that physical connection with their mothers after birth. They had more trouble with basic survival skills like regulating their heart rate, breathing, or blood pressure. UT Health San Antonio is beginning to implement Nurture Science after studying it in its own NICU.
Nurture Science says that you have to be co-regulated before you self-regulate. So if you have an emotional connection with someone, you can then develop it with other people. So you as a parent, if you can take it on to develop that emotional connection with your child, then your child is going to be equipped to handle other things.
Dr. Gong says shielding your child from the impacts of COVID-19 isn't always beneficial. While there may be aspects of the pandemic they can't understand, they can understand emotion.
We advise parents to do what we call calming cycles, where they cuddle their child and talk to them and concentrate on them, not have music playing or not be watching television or not be reading a book. You really need to concentrate on each other. And you may start with just sharing your feelings because kids don't understand. They don't understand what this is about. So you could, tell them, I'm really sad that we have this time where things are so different from the way they had been. I'm sad that I can't work and I can't support you right now. Whatever it is that is your situation, share that and work it out with your child. Don't ignore them.
And for older children, those less likely to cuddle, try as you might, conversation. That's been key for Wayment.
So I try to do that every day with my children. Sometimes it can be more challenging with my teenager and my other soon-to-be teenager, but to really get on eye level and to talk and to connect and to listen that way, where we're listening intently and with our body facing the other person and really hearing what they have to say.
The intent is to let your child talk about how they're feeling and to talk about how you're feeling.
Be willing to share something, because if you're not, your child's not going to be willing to listen.
And maybe the conversation starts about the newest level in their video game or a funny meme they saw. Wayman says it's amazing to see how those moments evolve. Physically connecting with your child can help them cope too.
It's physical touch. How many times a day do we pass by our children or, hey, can you hand me that plate? But can you, touch your son's face and show him your eyes, and say hello. How are you doing?
Wayment works in the Department of Pediatrics at UT Health, and she knew about Nurture Science before COVID. While it's not new for her, life in a pandemic is new for all parents, and kids are taking notice.
Sometimes our kids right now, even our young adult kids, are seeing their parents and caregivers in a real different way. So, kids, if the parent's trying to cope with a pandemic, they lost their job, it's really hard to maintain really good support and parenting skills during all of this.
But a few minutes could go a long way.
My children and I, each night we sit down and we share our feelings with each other. And I have learned so much by just knowing, okay, for the next 15 minutes, 20 minutes, sometimes only 5 minutes, this is what we're going to do. And, we end up feeling better afterward, and it strengthens that bond.